Welcome back to Between Two White Coats, a podcast designed to help you be the healthiest version of yourself. I'm Dr. Michelle Plaster, a family medicine doctor.
And I'm her co-host, Amber Foster, a family nurse practitioner. In our combined 30 years in medicine, we've seen a lot.
We're discussing key issues surrounding health and wellness, answering some of our biggest questions, overcoming health obstacles, and giving patient-centered advice in hopes of educating you and providing the tools you need to live a healthy life.
If you find our podcast helpful, please consider subscribing so you don't miss an episode. And don't forget to leave us a 5-star rating and review. This will help other people find our podcast.
Thanks for joining us. We look forward to serving you.
Thank you for joining us today. Today is especially exciting because we are talking about our wellness center. Yes, it has been years in the making. And
Years.
I
feel like since I came here 8 years ago, I'm like, Shelly, let's open up a wellness center. Can we do wellness center? And you're like, yes. And then now we finally are seeing it. And I'm so excited.
Yes. And 2 or 3 years ago, we were trying to break ground on it, and COVID hit and changed everything. And our direction went much more to taking care of
sick
people with COVID. And now we're able to do something that will help. COVID was sort of our reminder that on a day-to-day, if you can protect your health and your wellness and really put things into the wellness bank, then you can get hit with COVID and come out better. You can have things happen to you and heal more. And I think that really brings us to what we want to talk about today, why we built a wellness center and what we hope to do with the wellness center.
Yeah. I think that we are breaking our kind of our medical campus, as I like to call it, like the clinic and then the wellness center. And so there's only so much we can do in the clinic, and that is just the truth. There is only so much prevention, so much preventative meds. Number one, we are running out of space.
Yeah.
People, I think, are always surprised about actually how big our clinic is because it has all these hallways.
Twists and turns, and we use every square inch of it to try to help people. But we are out of room, which is a wonderful thing that we've outgrown our space. But it's also, we've sat in this space of meeting people after they have diagnosis.
Yeah, a little too late, just a tad bit too late.
On the day that we're giving them diagnosis. And what if not only could we prevent that by helping train people to be more focused on their health and focused on taking care of themselves so that they don't end up there, but also we feel like we have our hands tied too often. Mm-hmm. We know that the decisions you make will never be replaced with the pills we give you.
Yeah.
But how can we help people make better decisions? And the healthcare system that we've been handed doesn't allow us to have an hour to sit with people and talk about lifestyle medicine. But everything that you read will say diabetic, number one treatment, lifestyle. And then 72 paragraphs about all the other medicines and everything else. Hypertension, lifestyle, weight and obesity, lifestyle. But what are we actually doing as white coats to help people with their lifestyle? The system isn't really built to allow us to do that. But yet we know how important it is.
Yeah.
We have a lot of things going on in the wellness center that are a little bit different than what we do in primary care. And one of them is really trying to help people with self-care. So we have a cryotherapy chamber. We have an infrared sauna. We have IV and IM therapies so that people can say, okay, if I was trying to maximize my health and wellness, what would I be doing?
Yeah.
We have a movement space so that we can help try to make movement fun, and you can exercise and you can
build
have
strength.
A community of people around you. You can build strength and stamina. And stability, and so that you don't have falls as you age and you don't have other issues because you're strong.
And it's supporting all, I'm calling it medical support. I don't know if that's a great term, but it is a medical support. It's the things that we want to do in the clinic that we don't necessarily have the time to do in the clinic, and then we're giving you a ton of support in the wellness center with all of our modalities to try to help you live your best life while maybe having to deal with diabetes. What else can we do? What kind of support can we give you from a clinic standpoint and a wellness standpoint?
Yeah. So in the lifestyle medicine arena, we want to help you move safely and be active and stay active. We want you to know what you should be eating. Food is your fuel. And if you're putting in bad fuel, you've heard us say before, you're going to get bad results. And so we want to teach you about what should you be eating. And we have nutritionists who are going to help weigh in with that. We have a team of medical professionals, because the other thing that the Wellness Center is allowing us to do is something that primary care hasn't allowed us to do, and that's really to take this wonderful team approach to healthcare, where we have PhD nutritionist, PhD physical therapist, mental health professionals, all of us in the primary care arena that are all weighing in on the programs that we build. So everything we do in the Wellness Center is really based on 4 pillars of health. The big ones really for me are movement and nutrition. Without those 2 things, it's hard to talk about anything else. But we also really like to focus on your mental health and stress management, and your sleep. And if you're doing those 4 things well, the odds of other health issues getting you down to where you can't function are much slimmer.
Yeah.
So we want to teach people about those pillars of health. We want people to be motivated to prioritize that. So we're taking this entire team that can weigh in. So when we build programs for people in the Wellness Center, we have a mental health component to it. We have a nutrition component, a physical therapist, or other people in movement science. And we have all of us who have many years of experience and education in primary care. And we're really trying to take this full human approach to healthcare. I remember when I was applying to med school a lifetime ago and had to write my essay. I remember my essays for my medical applications were based on wanting to approach other humans from a whole mind, body, spirit approach to taking care of them. Because if any of those things aren't well, you're not going to be well. And so now, 25 years into a career, I've been able to now say, what can we offer you to help all of you? Not reduce you down to diabetes and a treatment plan for diabetes, or reduce you down to diagnosis and pills. But to really create a treatment plan that encompasses the entire human. Are you living your best life? And if not, what can we do to get you there? And that's not always, you may just know I'm not living my best life, but I can't put my finger on it. And so there may not be a diagnosis that has to be tagged in there. We are hoping that there won't be a pill. Yeah. Our goal is to be able to remove some medicines from people by helping them to take good care of themselves, and to create habits that make people really know that they are living their best life. Yeah. A couple of other small things and why we built a wellness center. Not only can we take the team approach and we can focus on these 4 pillars of health, but we also can really meet people where they are and help them find better, whatever better looks like. So since we've really been conceptualizing the Wellness Center, I have had the phrase better health, best self. And that's why we built a wellness center. Is we want people to have better health. We want people to be motivated to do what needs to be done, and we want to help them and encourage them and give them the right information and motivate them to act on that information. And we want people to be able to be their best self. Sometimes wellness isn't the absence of illness or even being able to fix an illness. Sometimes wellness is being able to live your best life with whatever it is that you're struggling with.
Well, and you said better. And so like you mentioned meeting people where they are. So like that's one of the things that I am super excited about with the Wellness Center and even our clinic is that we do meet people where they are, and we're like, okay, well, what works for you is not going to work for you. And so to have the team approach to say, hey, I need you to sit down with this nutritionist and I need you to sit down with this physical therapist and come up with a plan that you can stick to, that you're going to see change in, in your body and in your mental health and in your spiritual health. just for it to be such an individualized plan as opposed to kind of a one size fits all, because we do a lot of one size fits all medicine. You have blood pressure, you get this particular medication, so it's not always it's not a one size fits all in wellness, and as it can be sometimes in just regular clinic medicine.
And many times in regular clinic medicine, it's whatever the one size that insurance has said that they'll pay for.
Yeah.
And so it may not be that it is the best offering, but I would love to send a ton of people to diabetic education, but then if their insurance doesn't pay for diabetic education, and we don't even have diabetic education readily available in our county, and so we are going to make diabetic education available and affordable so that people can get this information from experts who wish to share it with them. One of the great things that I think we're going to be able to do in the Wellness Center is expand beyond what insurance has dictated is what we do. So one of the things we're doing is executive level physicals, really an expanded wellness exam, where we're expanding the labs that we do to dig deeper, to not just look for what you may have that we don't want to miss, but we're going to try to look for what may happen years down the road so that we can prevent it. So we're going to have expanded lab profiles that we do. We're going to do exercise evaluation so that we're looking at your strength, your stamina, your stability, and you can meet with our physical therapist who can create a program of exercise for you so that if you have a deficit in one of those areas, you'll know exactly how you should be exercising to fix that. This is, one of the things that we're motivated by is longevity medicine. We don't just want to keep you healthy for the next 5 years, 10 years. We want to keep you healthy for the next 30, 50 years. One of the tools that we use, I think one of the things that Western medicine does is look at things like 5-year and 10-year survival rates. With cancer, we talk a lot about 5-year survival rates. If I was diagnosed with cancer today and I'm 51 and I just kept hearing about 5-year survival rates, I would think in 5 years I'm going to be 56 and my son's going to be 15. That's not long enough. I don't want to talk about 5 years. I'm going to talk about 15. I want to talk about 30. When we talk about heart disease, we'll do cardiac risk calculator. This isn't for people who've had heart attacks. This is for people who were trying to figure out, will they? It's a 10-year risk calculator. So when I put a 40-year-old into a 10-year risk calculator, it's not as good as what I need it to be. I need to know, are you going to have a heart attack when you're 60?
Yeah.
Not just if you're going to have one before you turn 50. And so we're looking at more longevity medicine. How do we keep you healthy for longer? And we're not just looking at the next 5 or 10 years. So we want to give you an exercise program that allows you to do what you want to do when you're 80, when you're 90. That when everyone says, I don't want to live in a nursing home one day, which everyone says, well, that's, how do we turn that want into a reality? How do we make sure that you don't live in a nursing home one day because you are doing what needs to be done today and tomorrow so that you can live independently well into old age?
And we can keep you accountable, and we'll have our beautiful wellness clinic for you to come to.
Yes, absolutely. So we are really looking at things like functional medicine and more comprehensive medicine, and not having to dance within the restrictions that insurance mandates for us, and making a lot of things fun and enjoyable while you take care of yourself. So in one sentence, why did we build a wellness center?
Oh, I don't know if I can do one sentence. In one sentence. We just want to take better care of people.
Yeah.
Like, we just want to be able to offer better care.
Yeah. We want you to be your best and live your best life. And we understand that resources are needed for that. So, to have better health and be your best self, we want to give you those resources. Yeah. So please, if you are considering it at all, come and talk to us at our wellness center.
At least come look at it. It's beautiful.
Yeah, it's beautiful, and it's been like building the pyramids. It's been taken forever.
Please come look at it. It's been a lot
in the making. We would love to take you a tour of it.
Yeah.
And there are so many great offerings, and I really feel like just about anyone can benefit from a wellness program.
And it's still us. It's still the providers here that you guys all know and hopefully love us. So it's not like it will be all new, but it'll still be the same people that you love and trust.
Yeah, absolutely. We would love to see you at the Wellness Center. Come through and we'll give you a tour.
We like to leave you on a good note. Today's Tell Me Something Good comes from Stephanie in our call center. If you've ever called our office, you may have spoken to her. So Stephanie, tell us something good.
Something good is Smitty's.
Tell me more.
It is a hole-in-the-wall restaurant that is family owned, and they have the best chicken tenders ever.
So the Tell Me Something Good is locally owned restaurants that have the best chicken tenders. I love that.
Yes, absolutely.
Yes. Well, thank you for listening today. And until next time, take care of yourself.